Hi, I'm Jeff Stone, President of Project Help Long Island. Welcome to tonight's discussion, COVID's toll on our frontline workers. Our mission statement is the mission of Project Help, which is health, education, and life programs, is to provide families with education and awareness on mental health and addiction. COVID-19 has caused unforeseen consequences on our communities, and especially our important frontline workers. Most are exhausted, traumatized, and experiencing compassion fatigue. Join us as we hear their stories and learn how we can all be helpful and come together as a community.
We'd like to say thank you, a special thank you to the Port Washington Library for the Zoom meeting service for Project Help Long Island. We welcome coalition partners, Dr. Joe Smith of Long Island Reach and the Port Counseling Center, Jennifer DeSana and Connie Bruno of Manhasset CASA, David Sills and Ellen Ritz of NAMI. Project Help especially recognizes the generosity of the Peter and Jerry DeJana Family Foundation and the support of the Kiwanis Club of Manhasset and Port Washington. So it's my delight really to look at this panel and to have the pleasure to introduce all of you. So that's what I'm going to do. Eileen Clayton. Eileen Clayton is an RN with decades of experience in critical care nursing, nursing education, and hospital management. She also joins us tonight from Boise, Idaho, and look forward to her insights into the life of a nurse and hospital care and the impact on nurses by COVID. Elizabeth Weisburd is a EMT with the Port Washington Fire Department, Fire Medics 1. She is also a mom of 2, and because why not, she's the vice president of the Port Washington Board of Education in her spare time. Dr. Alec Cecil. Alec is a psychologist who has spent his career working with families and adolescents in New York City, particularly the Bronx, but he is also a disaster psychologist for the American Red Cross and the Armed Services. He is also an instructor and runs workshops for the Red Cross and military families. Celia Valmer. Celia Valmer has been with the American Red Cross for 14 years. She is the feeding lead for the mass care team on Long Island, a disaster action team supervisor, a Red Cross instructor, and she is deployed throughout New York State. In 2014, Celia was recognized by the Long Island Red Cross with its highest honor, and that is the Clara Barton Leadership Award. Randi Shubin Dresner, delighted to have you, Island Harvest Food Pantry. Randi is the president and CEO of Island Harvest. Island Harvest is the largest hunger relief organization on Long Island and has delivered millions of pounds of food through food pantries, soup kitchens, and nonprofit organizations. Thank you, Randi, for joining us. Major Sue Kim and Major Forever Young Kim of the Salvation Army, the Hempstead Citadel. Major Sue and Major Young have been with the Salvation Army for 25 years. And recently, this past August of 2020, they were summoned to come down to the Hempstead Citadel and replace Captain Roberts, who many of us know and admire. And as we all know, the Salvation Army is the quintessential boots on the ground, right? They're providing food and shelter and rehabilitation, child protection, poverty relief, and community relief. So welcome to Salvation Army. Jeff, did you want to say some opening comments?
Well, I would just like to say thank you to all of our guest speakers for agreeing to come on tonight and discuss what it's been like out there in the field. I know you're all very busy, and you've experienced quite a bit of good human behavior, not so good. Your boots on the ground. You really are the frontline workers, and I appreciate each and every one of you, what you do for others, and for being here tonight and sharing again your experience, strength, and hope, so that we can let others know that if you guys can do it, so can everyone else. Right? So Kathy can lead us off.
I concur, and I'd like to say sincerely, like Jeff has said, that Project Help is both proud and grateful to have you on this panel tonight. You are truly the front line and who we all turn to in a crisis, an emergency, in a disaster. You run in when others cannot. And tonight, as we begin our event, COVID's toll on frontline workers, we are nearly 1 year into a pandemic that none of us have ever experienced in our lifetime. The loss is staggering. Today, nearly 491,000 Americans have died, and there are 27.9 million COVID cases. So to start off, we'd like to learn about who you are, your profession, your organization. Tell us how things are before COVID, what your experience has been during COVID. And we'd like to know how the community can help you, our communities can help you, whether it's volunteers, donation, whether you need to spread the word, or maybe you just need a heartfelt thank you from folks. So welcome to you all, and we look forward to learning about you. So if I can get started with our panel of finding out and learning more about your organization, I'm going to start with Celia and Alec from the American Red Cross. The American Red Cross and that iconic Red Cross is known worldwide, right? When there's a disaster and people see that Red Cross, whether it's on a hat or on a jacket or on a shirt, people just know the cavalry has arrived. And so, Celia, perhaps, would you tell us about the Red Cross? What is it to be a volunteer? Do you need special training? Do you need special experience? Can you tell us about that?
You have to be over the age of 18 and sign up at redcross.org. They're going to take your personal information, do a background check, and then you're going to be contacted by someone from the American Red Cross who's going to have a conversation with you. There's so many different things ever changing and opportunities with the American Red Cross. And they're going to talk to you and see what you'd like to get started in. There are so many different divisions: disaster service, spiritual care, there's training, being an instructor. We also have youth groups. So we do have high schools and youth groups so that they assist the American Red Cross in many of our different missions. And you can get started in the area that you like. Just like myself, I started back to help shelter on Long Island in hurricanes, and now I'm an instructor and a supervisor of disaster teams and deploy. And many of us have many hands in many different areas of the American Red Cross. But when COVID came along, we had to quickly pivot, and like all of the organizations that are here today, and change is hard for some people, even volunteers or staff members, and changing to technology. Some people, volunteers, are afraid of technology, and it was very stressful for a lot of people to reorganize our training and to do that COVID training, or proper protocols for COVID. 2020 was probably the worst year for hurricanes that I can remember in all of the time that I've been with the American Red Cross. We had many volunteers who deployed during COVID, and that was very stressful for them, not knowing what they were going to encounter wherever they landed, and following the new protocols. But our volunteers are just so empathetic, and I know many of them volunteered for multiple deployments, and I'm sure Alec can talk a little bit about it. It became very stressful for some volunteers because we know they have a great heart and they want to volunteer and do all they can, but sometimes you need that time out. Sometimes you've got to take care of your own mental health. And I know the American Red Cross has those protocols for our volunteers to keep an eye on everyone, myself as a supervisor, watching my disaster teams to see if anybody needs, you know, a little extra help or a little time out or just a little mental health and a checkup, just, you know, a little check-in from someone from the American Red Cross. And I know Alec can talk a little bit more about that in the program through the American Red Cross.
Celia, can I ask you, how many Red Cross volunteers are there, and in how many countries around the world?
Oh
Do you
my!
know?
There is International Red Cross all over the country, hundreds, thousands of members just in the United States of America. Here on Long Island, we have about 800 volunteers, and the whole greater New York, it's in thousands. And that's just covering the 5 boroughs in Long Island, a little borough of upstate. So it's millions of volunteers. Yeah.
You know, if someone wanted to be a volunteer, do they have the opportunity to choose how many hours they want to volunteer?
Yes, there's a very low minimum hours that we really look for in volunteers. It's usually 4 shifts a month in disaster services itself. And sometimes you're not even called during the month if it's a slow season.
Yeah. Yeah.
Disaster.
Thank you. Thank you.
You're welcome.
Alec, you have a special role with the American Red Cross in that you're a psychologist, and so for the Red Cross, you're disaster psychologist, and you have been on scene for some horrific events that we have only watched unfold on television. And so as a psychologist myself, I'm very curious about you. And can you just say, you know, you get called on scene. Where do you start, Alec? What's your first step when you get called in?
Well, I think like all of the, you know, volunteers, I try to assess the situation. You know, we talk a lot in the Red Cross about situational awareness. So we want to understand, you know, what's going on when we get somewhere. And a lot of it has to do for somebody like me with looking around. You know, I sometimes say people like Celia have tough jobs because they have to go in and actually start setting up shelters and feeding people or assessing damage and providing financial assistance and things like that to folks. And I come in and I talk to people and listen to people. So a lot of it is trying to look for people who are in distress. Frequently people get referred to me, you know, usually when I get to an incident, people are, at least within the Red Cross, they're always happy to see me. Oh, talk to this person, talk to that person, people they've seen in distress. A lot of it is listening, of course, giving people an opportunity to talk about what happened to them and to help put things in perspective. So it's a terrible thing. The kinds of things, it depends what it is, but you know, they're the kinds of things nobody ever expects to happen to them. You know, get burned out of their house or their apartment, or, you know, God forbid, be involved in some sort of mass casualty situation. And
Yeah.
so it seems often unmanageable. And part of it is to say, look, most people get through this. You know, most people are resilient. And we do a lot of what we call psychological first aid or enhanced psychological first aid. And, you know, which involves just being there. A lot of it is really just being there for people in the beginning. So they know that they have support, that somebody's willing to listen to them, that we can provide some hope for them and make efforts at helping them connect with friends or family, with resources, trying to reassure them that they are safe, that, you know, after the incident. Depends, again, it's different depending on the kind of incident. We recently had a big incident in Yonkers. There was a fire in an apartment building, and a bunch of apartments were affected, but it was a 27-story building, and they had to vacate the whole building, which was over 300 apartments. So we had a lot of people who were displaced. Some had lost everything. Some would be able to get back in. So there were different experiences there. And to speak a little bit to what Celia was referring to, our procedures had to change pretty drastically for COVID. So, we don't have what we call congregate shelters now. For the most part, we have some, but where everybody's in like a big gym or someplace with cots, we put people up in hotels. And it's a challenge to the Red Cross folks who are used to having a little bit more personal contact with people, the clients who we try to serve.
I imagine there's a lot of Red Cross heading to Texas tonight.
Yep.
Right.
Well, I know they've opened a lot of shelters down there.
Mhm.
And Texas has had more than its share of incidents, hurricanes and other things. And,
Yeah.
On top of COVID this summer, of course, were all the wildfires in addition to the hurricanes. So there were, I think, more major operations at the same time for the Red Cross than they've ever had. And it was a real challenge. A lot of the work has been done remotely. So I've done a lot this year on the phone or on the computer. I run also a lot of workshops for Red Cross folks and, as you mentioned, military folks and other folks in the community on, dealing with the stress related to COVID or related to other things that, people are going through.
Mental health
Thank you.
services are just so important.
Yeah.
We just had a fire 2 weeks before Christmas. My partner responded. I did the work from home, the virtual work. But when he got there, the family was dragging the Christmas tree out of the burned out home. And it was devastating, not only for the responders to see what was happening to this family with 3 young children, but for the family themselves. And it is something that was featured on our Red Cross blog, but the person who lost their home and lost their Christmas tree and their entire holiday, he just kept calling me and thanking me for the mental health services that his family received. When a child experiences a fire or they're woken up in the middle of the night, they're not sleeping for a very long time after that.
No.
Event.
No.
So it's critical that they have those mental health services. And he just was so grateful that someone took the time to call the family and talk to him about what to expect from that emergency situation and how to get his children through that situation. So it's critical, mental health services that are provided.
Thank you, Celia. Thank you, Alec. I'd like to say hello to Randi Dresner, Island Harvest. And as I mentioned, it is the largest food pantry on Long Island. And Randi is the president and CEO. Randi, can you tell us, how did Island Harvest begin? What's its beginning? And before COVID, before you had to flip-flop, what was Island Harvest doing before COVID? But really, how did it start also?
So Island Harvest is almost 30 years old. And we were founded by a community activist who was going into a convenience store at the end of the day and saw that the manager was throwing away the excess food that they hadn't sold. And frustrated, she left and did a lot of research and went back to the manager and offered to work with him if he wouldn't mind, if he would donate that food. She knew that there was a safe house for women and children right nearby in the same town here on Long Island. And she assured him that there was laws written that would protect people who were donating food and moving it in good faith, the Bill Emerson Good Samaritan law. And he agreed to do it. He was a little reluctant. She took her first chicken salad sandwiches to that safe house and gave them to the families that were there, the women and children. But as she was leaving, many women ran up after her and asked her when she would be back. And she said that that was a moment that changed her life. And she knew that she needed to keep doing this work. And it grew from those very humble beginnings. We say it was a woman with a cooler and a station wagon and a big heart, to now we are the largest hunger relief organization on Long Island. We're actually a food bank. We are doing much more than just moving food these days, but from the chicken salad sandwich to now 14 million pounds of food, or what we say is the equivalent of supplementing about 13 million meals each year across Long Island.
Wow.
And so prior to COVID, what were we doing? Well, we were helping about 300,000 people across Long Island each year with food and support and services. What we like to say is that it takes more than just giving somebody a can of food to end hunger. Food insecurity is a tremendous problem, not just here on Long Island, but across the country. There are about, again, prior to COVID, about 46 million people across the country who struggle with food insecurity. And hunger, the way in our work, doesn't mean just missing lunch today or, skipping breakfast. Or the people that we're helping, the people that are food insecure. In fact, the definition of food insecurity is not knowing where your next good, healthy meal is going to consistently come from. And here on Long Island, again, prior to COVID, about 1 in 10 Long Islanders are struggling with food insecurity. And so imagine you go here on Long Island out to the mall or to the supermarket, to the store, and you could literally count 10 people, and statistically 1 out of each one of those groupings would be struggling, and most of them secretly struggling with food insecurity. And we know that there are parents who are missing meals so that their children could eat, families who give up not just 1 meal, but in some cases 2, or very often 3 meals in a day. When you talk to some children who are living with food insecurity, they'll tell you that they go to school simply because they know they're going to get a good hot meal at school through the free lunch, free breakfast program. And so our work is bold. There are pockets. We used to say years ago, my colleagues and I in the nonprofit sector would say that there were pockets of poverty all across Long Island, but nowadays we really speak about pockets of wealth, because there is so much poverty and people who are struggling across Long Island. And the truth of the matter is that if you're struggling with food insecurity, that there's a high probability that that's not the only problem that you're dealing with. Food insecurity is typically a result of something else. And so the stresses in the home may be dealing with job loss, low income, mental health issues, child care issues, transportation problems. Those of us that work in the nonprofit sector know the term social determinants of health, which all tie into our work. And so because of that, we know and recognize that we need to do much more than just give somebody a can of food. And so our organization is very robust with lots of programs. And so we have a division that we call community empowerment, where we provide support for SNAP, which is food stamps, education about it, enrollment services. We help people with referrals to all sorts of services across Long Island. We do nutrition education. We have a very strong program with about 10 dietitians on staff that go into the community and work with children, families, adults, to teach them about the importance of eating healthy, but also how do you cook a healthy meal when you're on a low income budget. It's overwhelming if you go into a supermarket and you only have $20 to buy food for your family. How do you do that? We do supermarket tours, and now we do it virtually. But since COVID, our world has completely changed, just like everybody else in the nonprofit sector. And we made some major pivots within the first week. We largely depend on donated food, and that stream of food had ended at that point rather suddenly. And so within a very short period of time, our pivot included completely becoming an organization completely purchasing all of our food and not depending on donated food. And so for us, within about a 2-week period of time, we increased our purchases by over 500%.
Wow.
And now anybody who's in a business world would know that you've had success when you make some changes at 10% or 15%. Our change was 500%, and it was immediate. And the other thing was that our network of food pantries in the community closed up virtually because they didn't have volunteers to help them at their sites. And so we needed to find new ways to get food and support and services into the community. And so through that, we opened up about 1,500 distribution sites across Long Island. And so if you recall in the beginning, I said that we helped last year 300,000 people in a typical year. Well, that actually more than doubled during COVID. And so it's not even a full year yet, but we have helped well over 550,000 families now, not individuals. And so you calculate how many people are in a family. And many of you have seen those images on TV with the lines snaked around parking lots. Well, that didn't happen only across the country. We had food distributions. In fact, the Red Cross was a partner in the last big food distribution we did at the Nassau Coliseum, where we helped 4,000 families in one day at the Coliseum. And the cars were snaked all around the Coliseum, down Hempstead Turnpike, and up the Meadowbrook Parkway. And at that very day, when I saw all of those cars waiting for food from our volunteers, I could recall saying, this is not a Billy Joel concert at the Coliseum. These are people that are online waiting for food in a very humble way. And the people that were online were people who were professionals, worked on Wall Street, physicians, attorneys, as well as others who were dependent on the nonprofit sector. I could go on and on. I'll end it here because there's plenty more to talk about during our presentation today.
Yeah, we're
Thank
going
you
to
for
get back
allowing
to
us
you.
to be part of this.
We're delighted.
Thank you.
I wanted to grab Beth Weisburd because Beth is actually on call right now as an EMT with fire medics. And so she could be pulled away from us at any time. Beth, could you, tell us what is it to be an EMT, and what kind of training is required, and also, in terms of before COVID, how just some idea of how many calls come in to emergency services in a day or a week or a year. What actually happens with 911 calls and how many we get. But go right ahead.
Sure. So I can start. Not sure why there's an echo, but anyway, so
No echo.
Okay, it's better. We are here in Port Washington. We're a volunteer fire department. We cover approximately 3,000 EMS calls a year, just in the peninsula of Port Washington. We do so with volunteers and some paid staff during the day to cover the sort of working hours that our volunteers are not available. To join the fire department is a somewhat extensive process as a volunteer. As you can imagine, we're sending people into people's homes, so there's background checks and other things that are clearly important to make sure that the community is safe. So that process has to happen. And then once you join the fire department, there is free training through the state of New York to become an EMT. It's about a 6-month process to get through that kind of that training. 6 months, 2 nights a week, 3 hours both nights, skills training, and as well as textbook or didactic learning.
Mm-hmm.
And then there's a state exam, both in skills and the book learning or didactic learning piece. And you become a New York State certified EMT, which is the first step. And the second step really is coming down and riding and really learning how to practice the profession, because learning in a classroom is clearly not quite enough. So we take people out on calls with experienced EMTs and teach them on the road as they go along, and then they become qualified EMTs. So it's probably a year-long process, start to finish, if somebody's interested in doing it. But it is an incredibly rewarding process. Something I came to late in life. So for those of you who know me, you would know that I only started doing this 3 years ago. It was something that I decided to do after my children were sort of not needing me anymore. And I was looking for something else to do.
That's not true.
At least
They
not in
never
a day-to-day
stop needing
basis,
you.
right? No, they call me 15 times a day. That's okay, even though they're all out of the house. But yes. So I've been doing this for about 3 years. I'm actually starting paramedic school, which is a whole nother step, sort of taking the education a step further in order to become an advanced life support provider. But it's definitely a very rewarding thing to do, and something that's really available and open to anybody at pretty much any age in the community that's interested in becoming a volunteer. So go ahead.
Can you say what your what is a typical call?
Oh,
Is there a typical call?
I would say there is no typical call and no typical day. We have calls that are anything from, somebody not feeling well and not having another way to get to the hospital, to, cardiac arrest, to, serious motor vehicle accident trauma, to anything you can think of, anything that might be wrong. We deal with a lot here, especially here in Port Washington. Our volunteers, unlike many towns, our volunteers are our first due 911 responders here in Port Washington. So we do everything here. We see every medical emergency that comes up in the town of Port Washington is covered by the Port Washington Fire Department.
Wow. Beth, do you remember your first run as an EMT, when you were certified and ready to go and the alarm goes off and
oh, I don't even, I remember some calls, but I don't remember my first one. Isn't that funny? You have some that stick with you, some that were a little tough, some that were interesting, some that, you won't see again. You'll see them one time and you really won't see the same thing again. We have nights that are quiet. I do a lot of overnights here, and then we have nights. Last night was busy. Today has been busy. Usually snowstorms are quieter, but today not so much. Today we've been busy. So it's it's definitely, it definitely can run the gamut. You never know what you're getting out for. A call comes over and it sounds like it's not much, and the person's actually in cardiac arrest. And sometimes the call comes over and it sounds like it's really serious and the person's okay. So
yes.
So you don't know until you walk into the house what you're going to see and what you're going to deal with.
Yeah.
But it's definitely rewarding, for sure.
Thank you. Eileen Clayton, critical care nurse, Boise, Idaho. You are an RN with over 30 years of experience in critical care. What does that entail? Can you paint a picture for us of when you are an RN in critical care nursing? What does that look like?
Well, I was thinking today that to explain it to you guys, it's so physically demanding, which I think a lot of people don't envision in nursing. You look at a movie and you see nurses and they're starting an IV or whatever. But here, you're on your feet for 12 hours and often 3-4 days in a row for a 12-hour shift. So it's physically demanding, and you have got to use every one of your senses constantly. As Kathy and I use this term, spidey sense. You get this little feeling that something's going on. But you have to know your vision, your sight, your smell, your touch has to be on the game all the time, because the slightest change in a patient can mean a dramatic change. It can mean death. And so I think what's been not as much for me as I'm watching some of my colleagues go through that are working now, they're they started, imagine what we knew a year ago versus what we know now. We didn't know much about COVID a year ago. So these nurses are walking into a room with a disease they're unsure of. They're not even sure if they're doing the right thing for the patient, and they're afraid for themselves. We didn't have enough ventilators. We didn't have enough protective equipment. And we might be forgetting that because we've moved on a year, but that's that trauma, that stress that they're still holding on to, that they worked through and still are working through sort of unknown conditions because it's evolving and it's changing. But to work in a room with a patient who's, you know, on a ventilator and lots of meds and drips, and you're in there for 12 hours. The hard part here too is they have no family to visit. And nurses depend on family for the emotional support of a patient because you're busy doing all those clinical things for them, but you need to, you need the family to come talk to them, to hold their hand, to tell them it's going to be okay. I was realizing today that I had a conversation with a friend, a patient on a ventilator who was highly sedated. Obviously you want to be sedated if you're on a ventilator, but if they'd had a family member there to hold their hand and talk to them, we can start backing off on the sedation because they're just so frightened to lie there in such discomfort and the fear. So you're trying to be a nurse, you're trying to be a psychologist, you're trying to be a respiratory therapist and a physical therapist and spiritual care, because you're limiting movement in and out of the room for as many people as you can. So I think ICU care pre-COVID was so different than it is now. And it does go back to that emotional support. And I'll try not to banter, but imagine you've worked 7 p.m. to 7 a.m. And now you go home and you have school-age children that are doing school via Zoom. Now you have to sleep sometime and you have to go back to work that night. This is a lot for people to juggle and to manage. Flip side of that, a lot of nurses got laid off during COVID because we canceled elective surgeries and clinics were closed and the opposite. So you have nurses now who are laid off, but they're not qualified to go in and help in the ICU. A nurse is not a nurse is a nurse. You know, an OB nurse is not going to go from delivering babies into the ICU. And so it's incredibly challenging to try to juggle all of that. And I am just so grateful, and I just have to say this, that the vaccine is out so that I would love to think that next year they're going to get a break because they are exhausted. Nurses are absolutely exhausted right now. And I've had conversations with friends who are like, I'd love to go for mental health support, but I'm too tired. I mean, they're just too tired. So I think if we could, again, look at supporting nurses in any way possible, thanking them. I mean, we all started out, they started in New York, honking the horns and clanging the pans, and that's gone now, and they're working harder than ever. So anything you can do to acknowledge them, I think is greatly appreciated. But family, not having family there is so difficult for nurses because they know they can't meet that emotional need of a patient that a family member can.
Thanks, Eileen. Thank you. And so now we turn to Major Sue and Major Young Kim of the Salvation Army. And like the American Red Cross, we all recognize your uniform. We recognize the ringing of the bells at holiday time outside the stores. But we know that there's so much more than that. You know, you are there in a crisis and you are there for the everyday struggle of those who are most vulnerable in our community. Could you please fill us in on what is the Salvation Army and what is it you do in your communities, in our communities?
You want to say that, Major, forever? First of all, thank you for having us.
We're
feel so
glad.
privileged to be part of this important meeting. Salvation Army began as a mission-oriented revival and reform movement in England 150 years ago. Now, unfortunately, in public perspective, not many people be aware that Salvation Army is a church, just knowing as a social service agency, but as a church, the Salvation Army has been spread their effort and work as a church, more than 120 countries as an international part of evangelical church. And before my wife, the Major Sue, as a ministerial partner, sharing the more detail, when we arrived as a new commanding officer in Hampstead, we tried to accomplish three aspects, understanding, knowing the dynamic nature of the community where we serve immediately, which is Hampstead area, and try to identify their need of community, and try to best way to serve the people and community as an individual and community. So it has been humbling yet challenging life learning experience in terms of knowing community and serving the community as a body of church. But as I listening such a wonderful, to me it's like a testimony, like a living witness from all of you. I feel so grateful and humble how even Alan, you remind me that how the so-called pastoral visitation could be critical and important, visiting patients in the hospital setting, that's a great reminder. And then Red Cross, we not compete each other, we are a team, right? But we respect, how the Red Cross has been established, a great heritage and then reputation, but at the same time, even the Randi, thank you for your wonderful service, great. Again, just remind me that, although we're living in the unprecedented life conditions, so-called the pandemic, crisis, but I just want to share what a humbling lifetime opportunity to seeking the way of living together with others, including nature. And at the same time, we should never forget to spread the message of hope about to the community.
Yeah, so I'll share the part about the local connection that we have in Hempstead, because we've just arrived in August, right in the middle of pandemic, from Rockland County. Right. And Rockland County to Nassau County, especially the village of Hempstead, is a culture shocker. I've never imagined what Hempstead would be like, when I arrived. And our building is faced right perpendicular from what is called Terrace Avenue, which is one of the most violent street in Long Island. And so, here we are trying to figure out, after being 15 years in an administrative office at Territorial Headquarters office in West Nyack, and also as, college for training officers who are becoming, future leaders. And so here we are after 15 years of serving and coming to a local venue of serving the field, and literally, as Kathy said, putting the boots on and putting the mask on, something that you never had to do. But also being out in the field every day. I mean, when we were at Territorial Headquarters, we were able to work remotely, but here we could not. We had to be where the local community was. We had to be out there with open doors. Whenever people came by for food, we had to be there. when they knock on our doors at 9 a.m., we have to open the doors to see what they need.
Mhm.
And, it's every day. Like tonight, it's because of snow that we're here at home
Mhm.
working at this hour, but we would normally be at the church, at the core. That's what we call it in
Yeah.
the Salvation Army. We would be at our building, and we would have about 8 to 10 kids coming in at ages of 7 to 11 who are doing their after school program and who get to run around in our gym. And they are just thrilled for the chance to just run around in the gym. And I think, we are located in the village of Hempstead, but actually we have zip codes that we serve. So Port Washington, Manhasset, some of these locations are where we serve as well. So we share the zip code with our Salvation Army facility in Freeport, and they have their own set of zip codes. And then Westbury, they have their own set of zip codes. So at our location, my husband, Forever Young, has already said that, we wanted to identify what our local needs were, and we had to do that very quickly. And remember, the COVID has shut down many of the services that we had previously supplied, and then we had to just revamp. What is it that we can do right now? What are the services that we can offer right now? And I just echo my husband's words that I am sitting in a room full of heroes. We can't do with our partners. We couldn't have done it with Island Harvest. We couldn't have done it with Long Island Cares. We could not have done it without the Pig Tie organization and many of the donors who gave us funding and food and donations of clothing, like North Shore Middle School, High School. They provided coats. They had a coat drive. We just gave them all out last week when we were providing food. And so every day we're open. And so Monday, Wednesday, and Thursday, we had to do appointments only, when the COVID hit. And then Tuesday, we have food giveaway every Tuesday from 10 to 3. And then Friday, we serve lunches. Before, we're not sure how they did it before. I think they had in the gym, they were able to serve meals. But this is something that we just started, and we're serving, meals every Friday from 11:30 to 2. And so every day there is some type of food available for them to take. And so I could tell you a story about a little boy who's just 12 years old. And he came by one Friday just to get lunches for his family of 6. Now, his brother is 17. He himself is 12 years old. He has a younger brother, 10 years old, and another sibling of a sister who is 4 years old. And it is a Latino family, and his mother cannot speak English. And his father, I'm not sure about where he is in the picture, but his older brother works. The 17-year-old works, so he couldn't come out and get the food. And so this 12-year-old boy brings out his cart every Tuesday, every Friday to come and get the food, and loads up his cart and brings it to his mother. And so these are some of the sweet stories of just warmth of a family and just love that they share in the household. And now he has joined with our music program on every Thursday. And so we were very happy that he's part of that. But we do whatever we can do right now that can provide assistance to our families to feed their hunger. There is so much need for hunger. As Randi said before, she's seen 500% increased capacity. Well, we've had 300% in our stats. We note that it's 300% capacity since it has died down recently. And we in the village of Hempstead provide so many food services. There are so many nonprofits who are giving food. So we do whatever we can, but we have many partners in our town. So we do other services as well. in addition to food services, and that is how to take care of the youth, because there is so much need on education in the village of Hempstead. There's only 30% in high school alone. It's 30% of math proficiency, 44% of reading proficiency, 54% of high school students graduate. That is an astronomical, it's a shocking number that should not happen anywhere in America. We're like the lowest level at national as far as high school graduation. And so, you know, I love working with the small children, you know, who are coming right now, who is thrilled to be at our building in a clean facility, you know, and I always say to my custodian, I want the children to smell bleach, literally. I want them to be in a clean facility where they can be free and just run around in the gym and just experience what life really should be. And so that's some of the things that we do. And of course, you know, Christmas toys, we gave out more than 1,000 toys and clothes as well during Christmas, and nursing homes we do, and we send kids to camp. Last year we had to do camp in a box, which was virtually done, which was interesting. But you know, one of the big item right now is the ESGCV grant that we received from Nassau County that came through CARES Act. We've received this huge funding from the government, but we're waiting because moratorium expires on May 1st. It's been, again, delayed, and now arrears are just multiplying, you know, since last March. And what my fear is that, you know, people were able to utilize their money, their funding, to use to spend on essentials because they didn't have to pay rent. But now with this being expired on May 1st, you know, they're not going to have any kind of money left. And 6 months, you know, through ESGCV, you're only allowed to get up to 6 months of rent. That has expired, that's gone. And so the funding that we have right now that could be given out to people, it's going to go very quickly, no matter how large amount of that sum is. And so we've received to spend on that, it's 900,000, but I multiplied it, I divided by 2,500, which could be like the average rental around in Nassau County. It's very small, as you know. I mean, that's small compared to what the rest of Nassau County is really paying out right now. That's just average that I was thinking. That's only 60 families with that $900,000. And that expires August of 2022. And so the need is great. We're trying to provide as much as we can, but yeah, but I'm glad to be with partners that I share this platform with, and that we're working towards the same goal to help our neighbors.
Sue, may I ask you, how many volunteers would you say you have, and are you in need of volunteers?
Oh, yes.
Yes, to both.
Yes, I raised both of my hands. Yes, send the volunteers. You know, I have an 82-year-old grandma. She has about 16 grandchildren of her own. She has great grandchildren. She is a member of our church. She's been serving every Tuesday, every Friday. She needs help to put out the tent. It's my husband and I pulling out the tent, you know, so that people could be under some type of tent when it rains, when it snows. You know, we put a little table out so they can get the boxes of food and, you know, take the food. She sits there from 10 to 3, literally, this 82-year-old woman. And we have an intern who comes, but we need volunteers. It's very hard to get. And I have, even for after school program, I pay our assistant teachers because our teachers are online. But I'm trying to open up a basketball program, you know, come in September, hopefully, you know, with the COVID restrictions still in place. But you know, we need volunteers for, you know, things like that, even to prepare food, cook food, however we can get that done. I would love to have that.
Thank you, Sue. Thank you for that great explanation.
Mhm.
So we've heard from everybody in terms of your organization and your profession. And now, and you've made some mention of COVID. It's March 2020, and we all shut down. So Island Harvest, Randi, what happens in March 2020 to Island Harvest? And where did you get what happened?
Well, March 9th is our day. That's the day that our organization completely transformed. On that day, when we saw that we were losing all of our food donations and word of COVID and its potential impact hit, my senior team and I sat together in a room to pull out our emergency plan and look to see what part of that plan is appropriate for this particular disaster that we didn't know very much about. What we did immediately was look at all of our protocols, and we recognized, again, we've been through disasters, obviously, to a different extent than Salvation Army or the Red Cross, of course, but since our founding, we have responded to many different disasters across Long Island. Some of them were fires and water crises and hurricanes and other things to provide food and support, but we knew that this was going to be different. And so we identified 4 different assets, if you will, that we needed to look at to protect. 1 was our staff, 2 was our food, 3 were our volunteers, and 4, just the organization as a whole and our processes and procedures. And so right away, we locked down the office and the warehouses. We have several locations across Long Island, and we wanted to make sure that the food was always going to be safe, that if someone came down with COVID, and again, back at that time, people didn't really know if touching something would be an issue for somebody who was infected. And so we only let 4 people in our warehouse and moved all of our operation outside. We got a tent in the back of our main building. And we sent people home to work remote. We sent other people out into the field. And if you were moved into one area or another, that was it. You couldn't change that. Our volunteer protocols changed dramatically. Island Harvest has 14,000 registered volunteers. At the time, there were 12,000 registered. And some were active, some were not, but we needed to change that right away. Now we put protocols into play so that when volunteers called to get involved with us, we knew that they would be as safe as possible. Since COVID, we've actually registered an additional 2,500 volunteers. And these are new people that had never been involved before. But many of them say to us that they've always wanted to do something when they had time, and because they were working at home or because they had lost their jobs or whatever it may be, they found this was the time to come and work with Island Harvest. I said before, we changed our model of how we got food. We changed the model of how we distributed food, and that was pretty dramatic for us as well. We're a very different organization today. We're not going back to the way we were before. We just bought a building in Melville. We're going to be moving. That was part of a capital campaign that had been planned for a number of years, but we just identified this building and moved. The move is next week. The building is twice the size of our current facility. And so we have a whole lot of plans for new programs that we'll be rolling out.
Randi, where does your food come from?
So our food comes from wholesalers, distributors, from retailers across the country and locally here on Long Island. We also get a tremendous amount of product from farmers upstate, out of state. on Long Island, and we actually have a farm ourselves. So we are farmers, and we get a lot of product from our own farm. And so a lot of the places that you know of, General Foods, Kraft, our food donors of ours, Costco, every retailer you can imagine, Target, most of the supermarkets, and then some smaller retailers as well. We're not looking for bagels from the local bakery or bagel store anymore. We're not looking just to fill bellies anymore. We're looking for good, healthy, nutritious food. We also are looking beyond, as I said before, just a can of food. And so we connect. So I'll give you a quick example. Years ago, we got a tractor trailer load of dried milk. We distributed out into our network a couple of times. People said, that's it. There's just so much dried milk that we could use. Our dietitians got involved, and they created cookbooks and came up with all different types of recipes, including making Play-Doh or something like Play-Doh. All of a sudden, we didn't have enough dried milk. Now we make an effort to distribute lots of nutrition information about the product we're distributing. And so if it's edamame or broccoli or collard greens, if it's canned foods, whatever it may be. And so we want to make sure that we tie together good health and nutrition, people's needs with food insecurity, and also teaching them how to become independent and self-sufficient.
Mm-hmm. Thank you, Randi. Thank you.
Sure.
Celia and Alec, American Red Cross. What's been the toughest demand on the Red Cross during COVID?
Well, a huge pivot for teaching. We do a lot of education with families and children, how to get a kit, make a plan, be informed. We have many different courses that we teach in elementary schools, high schools, tens of thousands of children every year. And now training all of those instructors like myself, instead of being in a school and training hundreds of kids a day, to do it online, Zoom courses, and having the school districts participate online. Also, a large outreach to the community. We used to install free smoke alarms in people's homes. And with COVID, we couldn't walk into people's homes with teams to install free smoke alarms. So pivoting with a lot of the different services and changing our services. Many, as Randi mentioned, American Red Cross has been helping with food. We've been working with the Salvation Army as well in Northport, Hempstead, with packaging food for people who are food insecure. We've been delivering meals with Meals on Wheels. We had an initiative, the New York City Healthcare Heroes, a donation by Deborah and Leon Black's Foundation. They gave out over 300,000 care packages and about 100,000 fruit boxes to healthcare heroes when they left their shifts in hospitals across New York City. So it's making that pivot and take services that you can no longer offer, and working with our community partners, all of who I know I personally have worked with, the Salvation Army in Hempstead, many shelters at Kennedy Park, and just working together to that common goal, particularly food insecurity on Long Island. It's really critically important.
Alec?
Well, I just want to, Celia was talking about the Healthcare Heroes program, and I happen to see two of our volunteers, friends and colleagues of mine, are on this meeting, Vivian Moy and Joe Spaccarelli, and they did a lot of that work, actually going to hospitals all over the city and the metropolitan area, bringing care packages to the healthcare workers in those hospitals. So I just want to recognize them for that and give them a big thank you. I think from my perspective, in some ways, it was the workforce that experienced a big change. You know, the fires still happen, and the hurricanes and the house fires, all those things. And we had to dramatically change how we respond rather than in person. For the most part, a lot of it was done remotely. people were interviewed on the phone, spoken to on the phone. Some of our, we call them CAC, the cards that we give financial assistance, they would be dropped off and, like put on the hood of a car, and then somebody would have to come pick it up from the hood of the car, particularly in the beginning. So we couldn't get close. And that took a toll on everybody. Also, because there were so many incidents nationally, and that took a big toll on everybody. And just dealing with COVID all around. A quick story, I was actually, a year ago in February, I was in Germany for the Red Cross for the Service to the Armed Forces on a number of military installations running groups. And we were supposed to then go to Italy, and that's when COVID hit. So we began doing the groups online, virtually, as a meeting like this. And we've done many of those groups for not only for military personnel, but for a lot of Red Cross workforce who are, struggling with COVID and struggling to meet the needs of all the folks who still experience these disasters or incidents. And so I think we've been doing a lot more of that than we usually would. And I think it's been difficult in that way, much harder for the workforce, but we keep doing what we do. And like everybody else, that's what we do.
Well, what strikes, I'm sorry, Celia, go ahead.
I was just going to say it's been very difficult for our responders. We go to home fires, and we do respond to fires pretty much every 6 or 7 minutes in the United States of America to a home fire, the American Red Cross. But traditionally, if someone was their home was destroyed, they could go and stay with a family member, and that's very different. A lot of families won't take in family members or friends, even to sleep on the sofa, and so that insecurity, not only of the food insecurity and not having clothes, but really going to sleep tonight. Not having those backup systems that through COVID a lot of families had, like family and friends and acquaintances would take them in. So very stressful.
Yeah, the other thing is that all the people who've experienced an incident have also been going through COVID for however many months. So, the stress of the incident is just on top of what they've been going through for all that time. So it has been harder, and from dealing with the mental health aspects, while we can do it remotely, online or on the phone, it's not the same thing as, for me, as being able to be with somebody.
That's what I'm hearing as I'm listening to you describe. There's a real lack of human touch right now, and so you've got people, they have lost their home, they're in a disaster, there's COVID. You can't put your arms around them, can you?
No,
You can't.
That's the biggest thing that our responders, Vivian Moy is here. There's nothing like a hug from Vivian Moy when you're under stress.
Vivian's hugged me. She hugs good, so.
Awesome.
There are a lot of hugs in the Red Cross. A lot of hugs in the Red Cross.
And it's hard. You can't put your hand around someone. You can't hold someone's child while they're trying to sift through their home to look for, whatever they can recover. So it's very different. So that's stress on responders. It really is that they, they can't do that anymore.
Yeah,
I think in the hospital setting too, obviously the touch, to touch someone with a plastic glove versus skin to skin is not the same. You have your hair covered and you have a mask on and you have splash goggles. They can't even see who you are. And that makes it so challenging to really establish a relationship. You can't even smile and let them know, hey, I'm smiling at you. I'm trying to make you feel better. And in the beginning, when healthcare workers were going through this, and I do want to expand and say, I can't say thank you enough to all the other people that work in healthcare facilities, the custodial staff, the cafeteria staff, the pharmacy. We could not function without all of those people. the laundry. You can't even imagine those. And these people are working hard every day. But
Yeah.
a healthcare worker will go, in the beginning, wouldn't go home because they were afraid they'd bring it to their family. We were waiting to learn and see. So you might work 3 or 4 12-hour shifts in a row and you wouldn't even go home and hug your children. You stayed in a hotel or somewhere else. And now, fortunately, we're learning more and we're evolving more with that. But the social isolation for healthcare people too, it's, you can't go to the restaurant after work or go to breakfast with your friends or go to your synagogue or, you know, to your karate studio, or you just, and so you didn't have those normal mental, emotional health releases that you might normally have. You know, you couldn't go, I'm going to go to my Pilates class and get rid of this stress. Nobody had their outlets anymore. And so hopefully now we're finding ways to work it. But that lack, as you were saying, of human touch. I got a phone call, I have to tell you this in the beginning. I was a neonatal ICU nurse for years, and I got a phone call, and I worked in infectious disease, and I got a phone call from leader of our healthcare system. Are we going to have to tell people they can't see their babies? I mean, can you imagine? Can you imagine if you have a child in the neonatal ICU and we're going to tell you you can't come in? And that's, again, we've learned and we've evolved and we know better, but the stress at that time for everyone was just incredible. And it doesn't just leave, you know, it doesn't just leave. So.
Well, I will say I when I do a lot of my groups, I suggest to people that they spread their arms out and then hug themselves. Because I think that's what you can do. And it actually can be quite comforting and helpful. And you all deserve it. You know, you need to take care of yourselves. And I think, you know, you're referring about the nursing, not having the families there had to be terribly stressful. And I know, you know, because I actually was on the other side of this myself, that nurses would often hold the phone up so that the families could try to talk to their often
Loved one.
very ill, maybe intubated relatives, you know, through FaceTime or whatever it may be. And that's just an additional stress on those nurses or whoever was doing it to have to witness that and, you know, not be able to do more and just have to take on more. So, you know, I know it's been very hard. And as you said, hopefully we're beginning to come out of that. But, and particularly in New York in the beginning, obviously, where, you know, we were just crushed with the number of cases and hospitalizations and deaths.
If I can ask Beth, Beth, as an EMT, what is the toll been on EMTs, emergency services since March of 2020? Was it not having available ambulances or not having rooms in the available at the ER? What was happening?
In the very, very early times of COVID here in March and April, the hospitals were busy. It was difficult to transfer patients. But we also saw a decline in other kinds of calls. So people were terrified to go to the hospital. So people were not calling when they were having things like chest pains and, you know, other more minor medical issues. And they were not getting care. And we saw the toll from that too, you know, the number of cardiac arrests and things because people were not accessing healthcare definitely increased. So overall, our call volume stayed fairly steady between the decline and sort of the other types of calls that we had. I mean, there weren't car accidents and traumas and other things because people were home. So some of those kinds of things really went down. So we did see, you know, we did see a decline in those kinds of things. So we were able to maintain. We also saw, you know, a decline in staffing. I mean, some of our older volunteers were not, and people with comorbidities were not able to come down and still are not coming down and doing duty because it's not, you know, safe for them. So, you know, in order to protect them, they have, you know, sort of had to withdraw a little bit. So that's understandable.
Mhm.
But you know, we've also seen, you know, it's sort of like everything else. You see the best of people, and we have seen, you know, people just rise to levels that are almost sort of remarkable to see. You know, you talked about, Eileen talked a little bit about the lack of contact, and one of the things I would say is the group of people that I have volunteered with over the last year here are probably my closest and dearest friends now. And, you know, one of the advantages to continuing to do this is we didn't lose that human contact. We had each other. We had people, you know, particularly in EMS where we're here and we're not necessarily just working a 12-hour shift and constantly with patients. We have some downtime here to spend together, to cook a meal, to have conversation, to sit around the table. And we really got to spend a lot of time together and got to know each other. And I mean, some of my best friends are 25 years old and you know, and some of them are much older than I am. So I'm not going to give away my age and say, but some of them are much older than I am. And it's just a wonderful, you know, that particular experience has been remarkable. And you know, I'll speak to, I had a call in the early summer, and it was a traumatic death of a young man. He was in his late 20s, and I had his father. His father had been on the scene, and we took his father to the hospital, and his father and his wife. And I had to tell his wife that she just lost her husband.
Mm.
And I distinctly remember, you know, something going through my head, and you know, it was that sort of make or break moment, as you said. I could not allow her, you know, you had that, you took a breath, and then there was the hug and the comforting, because there was just no way to not make that human contact. She clearly needed it.
Yeah.
And, you know, whether COVID, not COVID, you know, whatever the risk was, she clearly needed physical comforting. She clearly needed, you know, somebody to make that contact with her. She, you know, as I was bringing her in to say goodbye to her husband, who had been, you know, who had died suddenly, how do you not hold her hands? How do you not rub her back? How do you not? And you couldn't. And so I can fully understand that difficulty with the people who are not able to do that. You know, one of the other things that's been really tough is telling people, you know, even now this continues. Families can't go to the hospital. I'm picking people up, and you know, I have a 90-year-old man, husband and wife, and they're saying goodbye, because I mean, I can't tell you how many goodbyes I witnessed. And for many of them, it was the last time they were going to see their loved ones alive. And that's difficult, because that's something we don't deal with on a regular basis. We would typically take family with us. They would come to the hospital, they would get to go through the process. But we knew we were bringing people to the hospital, and they probably were not going to come home, and they were probably not going to see their family again. And so, you know, we definitely witnessed a lot of really difficult moments for people. So it's
Thank you
definitely
for sharing that
tough.
personal story. Thank you, Beth, for sharing that.
I appreciate you listening.
Absolutely. Jeff, did you want to jump in?
Yeah, I did. You know, I've been listening here, and again, I thank everyone for being here tonight. And what I see here is folks like Beth on the local level, town level here. I see someone on the Long Island level. I see someone on a state level, national and international level. And we all come together because the need is great, as Major Kim would say. And it's food, shelter, clothing, all of those things. The need is great, and it's getting greater. COVID threw us for a loop last year. Everyone was affected by it. But I also saw people stepping out and volunteering or asking to help here and there. What can I do? Whether it's donating foodstuffs, organizing a fundraiser for food, or clothing, or whatever it was. And that's what I would recommend. I'm sure you all do that to a certain degree, is to reach out to, say, for instance, high schools and colleges, the service clubs for volunteers. These kids love to volunteer. All right. And I know you're trying your best to keep everybody safe and protocols with COVID, and I understand that precautions. We do the same. But again, the service organizations as well, such as the Kiwanis or the Lions, Rotary, the Moose, all give of themselves monies, donations to organizations such as everyone here. And I want to know is two things. You're finding that there's been more volunteers calling up to give of their time, and that, and the donations monetary. Are they, is more of that, or is it less of that? And the clothing and food donations is more or less of that. But also, I've seen organizations pivot at the onset of COVID. You can't conduct business as usual. So everyone pivoted. I did, I know Kathy did in our respective careers, and we had to do things differently. All right. Some call it the new normal or whatever, but there's always more than one way to achieve, the desired ending here. And the need is always going to be great. So how are we going to make that happen? So I know you've had to do different approaches to take care of matters, and so I just wanted to know what's going on with regards to the public out there, because a lot of people want to give when in times of tragedies and turmoil, they like to give of themselves. Is that increasing? And I also want to know who takes care of the helpers, who helps the helpers, So it's a lot to unpack there, I know, but
That's another event, Jeff.
Yeah.
Jeff, I'd like to chime in here because for the first
Yes.
3 months of COVID, this community of Port Washington provided meals for our crews
Yes.
Wonderful.
for a good 3 months. We came here on duty and we knew we were going to be fed. And that was a tremendous sense of support. It definitely sort of, especially at the time where, nothing was open, it was hard for us to, get food at 2 a.m. when we were finally done for the day or whatever.
Yeah.
And it was provided for us by the community. And that was a pretty tremendous,
Yeah.
that was a pretty tremendous undertaking, and certainly a great feeling of support from our community.
Yeah, I can testify to that. Port is a wonderful town, and I wish other towns could be as fortunate as us. I know some are, and some aren't. But again, we have to help those who have a tough time trying to help their residents. So I don't know if anybody wanted to chime in or anything like that.
The American Red Cross, we actually got a lot more volunteers, and due to training going virtual, it was much easier for volunteers to take the courses 24 hours a day, whenever they wanted, whenever it was convenient for them, not when it was convenient for Celia to teach a class in Riverhead or Mineola. And so many more volunteers were able to get their core classes in and deploy faster than they normally would be able to, or to participate in Red Cross activities. And it's keeping them engaged that they can take their courses at their convenience and be promoted, from within.
Uh-huh.
Some good news from Boise, Idaho, is that we and by the way, I went to high school in West Nyack. I'm from Rockland County. But we have vaccination clinics, and I'm one of the volunteers. I belong to a group called Faith Community Nurses, and my goal now is to get all the elderly population of my synagogue to drive them to get their vaccinations, just because we have inclement weather. And but we have more volunteers than we can use, and that is really something to say. I mean, I think every retired nurse came out of the woodwork and is willing to volunteer. We have more volunteers than vaccine. So if we could just get more vaccine, we could get everybody vaccinated. But the local hospitals, our churches, our synagogues just put out who'll volunteer. And we have so many nurses that are willing to, nurses, CNAs, EMTs that are willing to volunteer to help vaccinate.
Wonderful.
Can all these volunteers be funneled into the Salvation Army or food pantries or the Red Cross? Can they be, you know, redirected?
Transport them. Scotty, beam me up.
Right, right,
That's great.
right.
I'm so glad you're on my side, Kathy.
Absolutely, absolutely. Friends,
At this
friends.
time, I would just want to have a screen share of a flyer with everybody's contact information, should anyone in the audience would like to reach out. And this, by the way, is something that you can take a screenshot of, a photo with your cell phone, or you could email us at projecthelplongisland@gmail.com. And believe it or not, we have had folks call up the speakers from time to time. I know they've called up myself and Kathy, and we're all too happy to help out where we can.
Yes,
You
yes.
know, and so it
Yes.
takes a village, but in this case, it takes a nation too, and
Mhm.
and international, and more oars in the water. We get to where we need to be, and that's what we did here at Project Help. We saw the need, we developed our mission, and we wanted to create awareness amongst our communities and spread the word out there. Stop the stigma. Mental health matters. We're going to have another one. Hashtag need. The need is great. Very important. All right. And what I want to do in just a minute too, you can keep on talking here. I'm just going to show our list of resources folks can call should they have something going on that they need to contact an organization or a person. And so what I want to do is just to do that right now, if I may.
Yeah, or maybe they want to make a donation, or they want to know how they can be helpful. If they can, maybe they want to do some volunteering or get additional information. And also Salvation Army, Island Harvest, Red Cross. You know, should you need something, reach out to us so that maybe we can spread that information out into the community as best as we can. Like Jeff said, it's working together, hands coming together. And, you know, we admire you all very much. To me, you are you're like the Navy SEALs of life. And it's just amazing to have the time just to talk with you and learn about you. And we're very grateful for you. Very grateful.
Definitely.
Yeah. Okay. So in any case, I think what we can do is go like that. And there we go. There's some numbers there. Again, you could screen share, shot this. We're going to have this recording, so you could check on our website, Project Help Long Island, or our Facebook page, Project Help Long Island. We'll have the recording up there. The library will also have the recording on in their library settings on YouTube as well.
And our YouTube
and our
also.
YouTube as well.
Yeah.
We also have an Instagram account. So again, these numbers are for folks that really need to talk with someone, and everything is kept anonymous. But again, we want to make sure that we can help out people where necessary. These are top pros. And again, I want to thank everybody here tonight. And please, we're going to reach out. Kiwanis is big on Long Island. The Lions are big on Long Island. And we love to provide service. And no doubt we can do that for each and every one here. More so if we're doing that already. I know our current New York State Kiwanis governor is from East Northport. All right, so all I have to do is ask her for a little help, and I'm sure that we can get the ball rolling and help out as much as we can. because we love to provide service and we
We do.
need service projects.
We do.
Yeah,
we do.
So, okay, let's stop the
Thank you for
share.
including me long distance. I appreciate it.
Oh, it
Well,
was
that's
great.
what's so great about Zoom. We could talk to anybody anywhere. I mean, I'm friends with Kiwanis people from Nepal, Kathmandu.
Wow.
Can you believe that? Yeah. So
When COVID is over, you all have a place to stay and go fly fishing. Come on.
during the very warm months in Idaho, I might add. What is it, about -10 there right now?
It's not too bad. I'm not telling.
Okay, well, we got a little snow here, not much. But is there anything else that we wanted to add, Kathy?
No, I think that we are, it's a wrap. And again, Project Help thanks you deeply for coming on tonight. And, reach out to us. And if we can help you in any way, that's exactly what we want to do. We're friends.
Okay, well,
We have all these new friends.
good night, stay safe, stay healthy, stay warm, and we'll see each other again, I'm sure. All right?
Thank
Thanks
you
a lot,
very
Fort
much.
Library.
Thank you.
Thank you.